Ever pondered the significance of early detection when it comes to colon cancer? It's an intriguing question that can literally save lives. Delving into this topic, we begin by understanding that colon cancer, like many other types of cancer, starts small. It often begins as non-cancerous or benign clumps of cells called polyps. Over time, some of these polyps can develop into colon cancers. Hence, the first step in early detection is regular screening tests to find polyps and remove them before they have the chance to turn cancerous. The second step involves being aware of the symptoms. Even though colon cancer can be present without any signs, some people might experience changes in bowel habits, rectal bleeding, persistent abdominal discomfort, weakness or fatigue, or unexplained weight loss. Paying attention to these signs and seeking medical advice promptly can lead to early detection. The third step is understanding risk factors. Certain elements increase the likelihood of developing colon cancer, such as aging, a personal history of colorectal polyps or colorectal cancer, inflammatory intestinal conditions, inherited syndromes, family history of colon cancer, low-fiber, high-fat diet, diabetes, obesity, smoking, alcohol, and radiation therapy directed at the abdomen. The fourth step is maintaining a healthy lifestyle. Regular exercise, a diet rich in fruits, vegetables, and whole grains, and limiting alcohol consumption and quitting smoking can all contribute to reducing the risk of colon cancer. To wrap it all up, early detection of colon cancer revolves around four main aspects: regular screening, being aware of the symptoms, understanding the risk factors, and maintaining a healthy lifestyle. Remember, colon cancer doesn't always show symptoms in the early stages, which is why regular screenings are so crucial. Being proactive about your health could mean the difference between catching colon cancer in its early, more treatable stages or facing a much tougher battle down the line. Knowledge truly is power when it comes to combating this disease. So keep these points in mind, stay vigilant, and always consult a healthcare professional if you have any concerns.